Prevention of dental caries with dental sealants. Introduction. Dental caries is an issue of concern as it is a common chronic disease that is responsible for a lot of pain and disability seen in all age groups. Untreated dental caries causes pain, infection, and loss of some or all teeth. The last few decades have seen several advancements in the prevention of dental caries. Sealants are one such advancement and are used on teeth as a preventive measure against dental caries. Discussion. According to the American Dental Association, dental sealants act as a barrier, protecting the teeth against decay-causing bacteria. The sealants are usually applied to the chewing surfaces of the back teeth, premolars and molars, where decay occurs most often. Adults have 32 teeth classified into incisors, canines, premolars, and molars. Dental caries can affect any of these teeth, but the premolars and molars, or the chewing teeth, are the most prone to dental caries. Dental caries are injuries and destruction of the calcified structures of the teeth by Streptococcus and other bacteria. Dental caries is extremely prevalent in the United States, with about 15% of the population affected by it. Caries may develop on smooth tooth surfaces and chewing surfaces but is mostly seen in pits and fissures. Dental sealants were developed as a means to prevent caries in the pits and grooves of occlusal surfaces of the posterior teeth, meaning premolars and molars. Dental or tooth sealants are adherent materials most commonly consisting of plastic or resin. It adjusts the resistance of the teeth to caries as they coat the occlusal grooves and seal them from exposure to external elements including bacteria and bacterial action. With the rationale behind the use of dental sealants, children are the main target. However, current trends indicate that they are even used for newly erupted teeth that show marked pits and fissures and in adults with significant previous occlusal caries. Permanent premolars and molars are the teeth that benefit most from the use of sealants. These teeth erupt between the ages of 6 and 12. It is for this reason that children between the ages of 5 and 15 make up the target age group for dental sealants. They are cost-effective and yet are found to be underutilized in the prevention of dental caries. Studies have shown that 74% of permanent first molars that receive sealant treatment do display signs of dental caries. The objective of using a sealant is that it should penetrate the pits and fissures of teeth and lid them from bacteria and bacterial action. The ideal sealant material should have properties that include prolonged retention properties, low solubility in the environment of the mouth, be biocompatible with the oral tissues, and be easy and simple to apply to the teeth. Since 1967, several materials have been tried and tested. Currently, the most commonly used sealant is resin. The existing ones employed at this time are second and third generation products that demonstrate a much higher retentive capacity than the first generation materials. The materials used currently as dental sealants are filled, unfilled, and fluoride-releasing filled cyanoacrylates, polyurethane resins, and bisphenol glycidyl, bis-GMA, resins. The initial problem faced with dental sealants was retention. These failures have been historically attributed to errors in the technique for sealant application, with moisture contamination being the main culprit. Besides the proper application, the eruption status of the teeth is also important. In incompletely erupted teeth, the retention rate of dental sealants is low. The loss of sealant occurs mostly from the lingual surfaces of the maxillary molars and the buccal surfaces of the mandibular molars, which is attributed to the shallower pits that make it more difficult for the etching required. Evidence shows that the retention of dental sealants is 80% at 1 year, 71% for 2 years, 58% for 3 years, and 43% for 4 years. Traditionally, sealants were targeted as a preventive measure for children and teenagers during their most cavity-prone period. However, age is not a restrictive factor for its use. Candidates suitable for the use of dental sealants irrespective of age include patients who have xerostomia, undergoing orthodontic treatment, showing evidence of incipient caries, and patients prone to dental caries. Sealants do not provide benefits to all molars and premolars. Posterior teeth that show shallow or well-coalesced pits and fissures or low risk for dental caries are not suitable for the use of sealants. There are contraindications for the use of sealants which include teeth with proximal decay and semi-erupted teeth, particularly molars with an operculum present. Conclusion: dental sealants is a cost-effective means to prevent dental caries. Improved sealant material and better application techniques have increased their retention. There is growing evidence that shows that dental sealants are effective in the prevention of dental caries, so their increased use can reduce the incidence of dental caries.